Vaginal discharge, types, colors, treatment, prevention. Vaginal discharge can be a normal cleaning process of the body. The same it can be a warning of a serious medical condition. In this video, you will learn different types of vaginal discharge causes, prevention, methods, and simple tips to help you treat or manage an abnormal vaginal discharge. Before I proceed, please support us by liking the video and subscribing to the channel. Your positive interaction signals YouTube to share the video to more viewers. Vaginal discharge is a mixture of liquid, cells, and bacteria that lubricate and protect the vagina. This mixture is constantly produced by the cells of the vagina and cervix, and it exits the body through the vaginal opening. The composition, amount, and quality of discharge varies between individuals and can vary throughout the menstrual cycle and throughout the stages of sexual and reproductive development. Types of vaginal discharge. There are different types of vaginal discharge. The common include white. This infection is associated with a thick white discharge common at the beginning and end of your cycle. This type of vaginal discharge is not accompanied by itching. In case itching is present, it can indicate a yeast infection. Clear and stretchy. This discharge is often called fertile mucus because it occurs during ovulation. Clear and watery. This tends to occur at different times of the menstrual cycle and can be particularly heavy after exercising. Yellow or green. These colors often indicate infection, especially if it is thick or clumpy like cottage cheese or it cause a foul odor. Brown. This can happen right after periods. It is just the normal cleaning process of the body to get rid of old blood that was not removed during your period. Brown spotting or bleeding. Brown vaginal discharge may occur when you are ovulating or in mid-cycle. Sometimes early in pregnancy, you may have spotting or brownish discharge at the time your period would normally come. Vaginal discharge colors. Normal vaginal discharge may have a thin, watery consistency or a thick, sticky consistency, and it may be clear or white in color. It may be large in volume, but typically does not have a strong odor, nor is it typically associated with itching or pain. While most discharge is considered physiologic or represents normal functioning of the body, some changes in discharge can reflect infection or other pathological processes. Infections that may cause changes in vaginal discharge include vaginal yeast infections, bacterial vaginosis, and sexually transmitted infections. The characteristics of abnormal vaginal discharge vary depending on the cause, but common features include a change of color, a foul odor, and associated symptoms such as itching, burning, pelvic pain, or pain during sexual intercourse. Abnormal discharge types and smells. Abnormal discharge can occur in a number of conditions, including infections and imbalances in vaginal flora or pH. Sometimes abnormal vaginal discharge may not have a known cause. In one study looking at women presenting to clinic with concerns about vaginal discharge or a foul smell in their vagina, it was found that 34% had bacterial vaginosis and 23% had vaginal candidiasis, yeast infection. 32% of patients were found to have sexually transmitted infections, including Chlamydia, Gonorrhea, Trichomonas, or Genital Herpes. Diagnosing the cause of abnormal vaginal discharge can be difficult, though a potassium hydroxide test or vaginal pH analysis may be used. When abnormal discharge occurs with burning, irritation, or itching on the vulva, it is called vaginitis. The most common causes of pathological vaginal discharge in adolescents and adults are described below. Bacterial vaginitis. Bacterial vaginosis is BV. It's an infection caused by a change in the vaginal flora, which refers to the community of organisms that live in the vagina. It is the most common cause of pathological vaginal discharge in women of childbearing age and accounts for 40 to 50% of cases. In BV, the vagina experiences a decrease in a bacterium called lactobacilli and a relative increase in a multitude of anaerobic bacteria, with the most predominant being Gardnerella vaginalis. This imbalance results in characteristics vaginal discharge experienced by patients with bacterial vaginosis. The discharge in bacterial vaginosis has a characteristic strong fishy odor, which is caused by the relative increase in anaerobic bacteria. The discharge is typically thin and gray or occasionally green. It sometimes is accompanied by burning with urination. Itching is rare but occurs in some women. The exact reasons for the disruption of vaginal flora leading to BV are not fully known. However, factors associated with bacterial vaginosis include antibiotic use, unprotected sex, douching, and using an intrauterine device, IUD. The role of sex in BV is unknown, and BV is not considered an STI. Vaginal yeast infection. A vaginal yeast infection or vaginal candidiasis results from overgrowth of Candida albicans or yeast in the vagina. This is relatively common vaginal infection, with over 75% of women having experienced at least one yeast infection at some point in their life. Risk factors for yeast infection include recent antibiotic use, diabetes, immunosuppression, increased estrogen levels, the use of certain contraceptive devices, including intrauterine devices, diaphragms, or sponges. It is not a sexually transmitted infection. Discharge is not always present in vaginal yeast infections, but when occurring, it is typically odorless, thick, white, and clumpy. Vaginal itching is the most common symptom of Candida vulvovaginitis. Women may also experience burning, soreness, irritation, pain during urination, or pain during sex. The diagnosis of vaginal yeast infection is made by looking at a sample taken from the vagina under a microscope that shows a hyphae, yeast, or form a culture. Trichomonas vaginitis. Trichomonas vaginitis is an infection acquired through sex that is associated with vaginal discharge. It can be transmitted by way of the penis to the vagina to the penis, or from vagina to vagina. The discharge in trichomonas is typically yellowish green in color. It sometimes is frothy and can have a foul smell. Other symptoms may include vaginal burning or itching, pain with urination, or pain with sexual intercourse. Trichomonas is diagnosed by looking at a sample of discharge under the microscope showing trichomonads moving on the slide. However, in women with trichomonas, the organism is typically detected in only 60 to 80% of the cases. Other testing, including a culture of the discharge or a PCR assay, are more likely to detect the organism. Treatment is with a one-time dose of oral antibiotics, most commonly metronidazole or tindazole. Chlamydia and gonorrhea. Chlamydia and gonorrhea can also cause vaginal discharge, though more often than not, these infections do not cause symptoms. The vaginal discharge in chlamydia is typically pus-filled, but it is important to note that in around 80% of cases, chlamydia does not cause discharge. Gonorrhea can also cause pus-filled vaginal discharge, but gonorrhea is similarly asymptomatic in up to 50% of cases. If the vaginal discharge is accompanied by pelvic pain, this is suggestive of pelvic inflammatory disease, PID, a condition in which bacteria have moved up the reproductive tract. Before puberty. The most common reason prepubertal females go to the gynecologist is concern about vaginal discharge and vaginal odor. The causes of abnormal vaginal discharge in prepubertal girls are different than in adults and are usually related to lifestyle factors such as irritation from harsh soaps or tight clothing. The vagina of prepubertal girls, due to lack of estrogen, is thin-walled and has a different microbiota. Additionally, the vulva in prepubertal girls lacks pubic hair. These features make the vagina more prone to bacterial infection. The bacteria that are more commonly responsible for vaginal discharge in prepubertal girls are distinct from those in other age groups and include bacteroides, Peptostreptococcus, and Candida yeast. These can derive from colonization of the vagina with oral or fecal bacteria. Another cause of vaginal discharge in prepubertal girls is the presence of a foreign object, such as a toy or a piece of toilet paper. In the case of a foreign body, the discharge is often bloody or brown. Other causes. Foreign objects can cause a chronic vaginal discharge with a foul odor. Common foreign objects found in adolescents and adults are tampons, toilet paper, and objects used for sexual arousal. Vaginal discharge treatment. Keep your genital area clean and dry when you have vaginitis. Make sure to seek help from healthcare provider for the best treatment. Here are some simple steps you can use to treat or manage your vaginal infection. Avoid soap and just rinse with water to clean yourself. Soak in a warm but not hot bath may help your symptoms. Dry thoroughly afterwards. Rather than using a towel to dry, you may find that a gentle use of a warm or cold air from a hair dryer may result in less irritation than the use of a towel. Avoid douching. Many women feel cleaner when they douche, but it may actually worsen symptoms because it removes healthy bacteria that line the vagina. These bacteria help protect the vagina against infection. Other tips are avoid using hygiene sprays, fragrances, or powders in the genital area. Use pads and not tampons while you have an infection. If you have diabetes, keep your blood sugar levels in good control. Allow more air to reach your genital area. You can do this by wearing loose-fitting clothes and not wearing pantyhose, wearing cotton underwear rather than synthetic, or underwear that has a cotton lining in the crotch. Cotton increases the flow and decreases moisture buildup, or not wearing underwear. Girls and women should also know how to properly clean their genital area while bathing or showering. Wipe properly after using the toilet, always from front to back. Wash thoroughly before and after using the bathroom. Always practice safe sex. Use condoms to avoid catching or spreading infection. When to contact a medical professional. Call your provider right away if you have vaginal discharge. You have a fever or pain in your pelvis or belly area. You may have been exposed to STIs. Changes that could indicate a problem such as infection include you have a sudden change in the amount, color, odor, or consistency of discharge. You have itching, redness, and swelling in the genital area. You think that your symptoms may be related to a medicine that you're taking. You are concerned that you may have an STI, or you are unsure if you have been exposed. You have symptoms that get worse or last longer than 1 week despite home care measures. You have some blisters or other sores on your vagina or vulva. You have burning with urination or other urinary symptoms. This may mean that you have a urinary tract infection. Thank you for watching to the end. Please like the video and subscribe to the channel to support us. Remember to hit the bell icon to receive notification of new videos. If you have any suggestions, kindly share it below with our viewers.